support the mobile solutions team in developing and bringing CycleTel, CycleBeads, and other products to market around the world. I'll be your moderator for this webinar. Today we're going to shed light on the question, where will you and the broader community be getting your family planning in 5 years? Customers around the world are connecting to the internet and finding a world of products and services available at their fingertips. Given this phenomenal growth, reproductive health supplies and information have also become more available online and through new channels in obtaining these essential products and services. This webinar will mark the launch of a comprehensive report and case study series on this topic. Each case study provides an in-depth look at either a specific country, we have India, Kenya, Mexico, and the United States, or a new and underused reproductive health supply. We have emergency contraception, female condoms, and the standard days method. First, we'll start with a brief introduction of the Reproductive Health Supplies Coalition and the New and Underused Reproductive Health Technologies Caucus by Sophia De Levi-Ori from RHSC. She'll discuss why this research took place and what bigger questions it is trying to answer in the context of the RHSC Innovation Fund grants. Then we'll provide a summary overview of the research project, some high-level cross-cutting themes that emerge from this endeavor, and then the case study partners will each present a snapshot of their biggest takeaways. We'll leave time for Q&A at the end, so please feel free to submit questions via the chat box in the corner of your screen. We'll collect your questions throughout and share them with our panelists at the end for discussion. To start off, I'd like to introduce Sophia De Levi-Ori from RHSC. She is a senior program assistant and manages the Innovation Fund, supports donor reporting, and backstops the Coalition Systems Strengthening Working Group and Market Development Approaches Working Group. She also serves as the Secretariat Lead for the New and Underused Reproductive Health Technologies Caucus. All right, Sophia.
Hi, thanks so much, Nikki. So just as a little background, in case anyone's not familiar, the Coalition itself is a membership organization with 364 partners committed to increasing access to a full range of affordable and quality reproductive health supplies in low and middle income countries. And the Institute of Reproductive Health at Georgetown conducted this work in part through one of our Innovation Fund grants. And our Innovation Fund is kind of the Coalition's flagship initiative for high impact change. So this is a small grants mechanism for financing innovative ideas to increase access to quality and affordable reproductive health supplies. And this grant was funneled through our New and Underused Reproductive Health Technologies Caucus. So as you can see, the caucus has 13 identified products that have been identified as new or underused, which is defined as reproductive health technologies that are not routinely available in the public, private, or social marketing sectors, as well as those technologies which are not routinely procured by the major procurers. So this grant is really an exciting one because e-commerce has the potential to be a game changer for access to all reproductive health technologies, and it's really wonderful to see the spotlight focused on these new and underused reproductive health technologies. So thank you so much to all of the hard work, the whole team at Institute of Reproductive Health at Georgetown, and I think we're really excited to be disseminating this great work.
Thank you, Sophia. I'd now like to introduce Victoria Jennings, the Director of the Institute for Reproductive Health and a longtime member of RHSC's NERDS Caucus. She led the development and implementation of this initiative.
Thank you very much, Nikki, and greetings, everyone. Thank you so much for joining us today. And a special thank you to the Reproductive Health Supplies Coalition and to the NERD Caucus for your support of this effort, and also to USAID, which has also contributed to this initiative. As Nikki mentioned, the growth of e-commerce has been substantial. And when we first began this research, we had so many questions about its impact on reproductive health supplies. We had to design a strategy that would allow us to look at the broader changes in the global market that are resulting from e-commerce without being so broad that we would only be able to speak in generalities. We started, as you know, with 4 countries and 3 new or underutilized methods. For each one, we chose an expert partner to conduct research and draft an in-depth case study. These 7 different perspectives were combined to give us both a wide global and an in-depth local perspective on the reproductive health supplies online market. But at this point, you may be even wondering, why did we do this in the first place? Why look at e-commerce and reproductive health supplies? Well, as you probably know, the internet has changed the way people purchase goods and services and broadened considerably the range of products available at a click of a button. Fake owl vomit and a UFO detector are only two of the millions of products available to you right now. So why not your reproductive health supplies? If people can get anything that they can think of online, and many things they can't, then this trend is big. We know that it will impact the market for reproductive health supplies and information, but we found very little research on exactly how. As we and our partners researched the specific methods and countries, we found that some universal findings emerged. Not all of these will apply equally to every setting or method, but these were factors that were mentioned over and over again. From the research on countries, it was clear that e-commerce for reproductive health supplies is here. Every country found evidence of online sales for at least one method. However, the range of methods available and the importance of the market varied greatly among countries. Researchers in Kenya, for example, found that e-commerce in general is still in its earliest stages, while researchers in the US and India found many method choices online. It was also clear from the country research that the online market for reproductive health supplies has to be viewed in the context of both the broader e-commerce market and the broader family planning environment. I'll get into those factors in a bit more detail in a moment. Research on the methods of family planning indicated that, as you may expect, the characteristics of each method strongly influenced how easily each could transition to the online market. For example, as you'll hear later, access to emergency contraception online was frequently dictated by the prescription requirements of the country. Underused methods, such as the three that were examined here, were limited, all of them, by customers' lack of awareness. If they hadn't heard about female condoms, they may not know where to search for them on Amazon. Some methods will never be suitable for online sales because they require the assistance of a healthcare professional, while others, like the standard days method, can adapt their entire product to online distribution. A few of these threads tied our findings together. We will go through each of these in detail now. The first is that a complex infrastructure must be in place to make e-commerce work. Everything from internet access to payment mechanisms to reliable delivery services. It seems obvious, but there were so many components that have to come together before a reproductive health supply can go from a warehouse to customer. That's certainly true with offline sales, but it is true in other ways with online sales. In countries like the US, as you'll hear, these conditions have basically been met. E-commerce is widespread, and e-commerce for reproductive health supplies is poised to grow. In other countries, enterprising customers and sellers have been able to overcome some of these barriers, but the lack of one or more components has negatively affected the online reproductive health supplies market. Regulation seems to be the ultimate conundrum. Over-regulation, particularly around prescriptions or age requirements, prevents customers from easily accessing their preferred method. Under-regulation means that customers may choose not to order or pay online for fear of illegal drugs or online fraud. And in some places, people weren't clear on what the regulations were, or the regulations themselves are unclear. This led to sellers choosing not to offer perfectly legal reproductive health supplies. I'm sure all of us have found that the internet is a wonderful source of information. Customers can learn about new methods, which they can then either purchase online or request through a traditional channel. They can also share stories about their own use of family planning and solicit advice from others. This information exchange is happening every day around all kinds of products and could lead to more and better use of reproductive health supplies. However, the internet is also a wonderful source of disinformation. We found that it is not always easy for customers to search for products or to sort through the deluge of possibilities to find the most accurate sources of information. We found that despite these limitations, online sources may be able to provide enough information to allow customers to buy a method online with confidence. A word you keep hearing me say is customers. They are the center of the ecosystem, and their preferences and choices will drive the growth or lack thereof of reproductive health supplies online. We found that they're attracted by the convenience of online purchases, like the potential for privacy and anonymity, and like to be able to access more choices of methods and within methods than they may be able to find offline. But we also found that they're very aware of the risks of e-commerce purchases. They had concerns about the timing and reliability of delivery, preserving their privacy throughout, and navigating the payment process. Many people have been getting family planning through a traditional source for years, so they would need to see that ordering online improved their experience. Customers are always weighing their options to choose what's best for them. The case studies on emergency contraception, female condoms, and CYCLEBEADS will be of special interest to our audience from the new and underutilized Reproductive Health Technologies Caucus, which we fondly call NERT. We will let each of them speak for themselves, but at a high level, we found that customers lacked awareness of NERT, both offline and online. Introducing them via e-commerce was about to increase their awareness and provide an access point for those who lacked it. However, offline barriers that prevent wider use of these methods are still present in online markets.
Thank you, Victoria. Now, I'd like to introduce each of our case study leads and let them tell you a little bit about what they found during the course of this research. Each of these cases could support their own webinar. They would only be able to give you a brief highlight here. I'd like to start by introducing Jennifer John, who led the research and development of the U.S. case study in collaboration with IRH. In her other life at Gender Lens Capital, Jen channels her insight and network in the Gender Lens investing field to diverse projects, and she'll now talk to us about e-commerce and family planning in the U.S.
Thanks, Nikki, and hi, everyone. The story we want to tell here of e-commerce for family planning methods in the U.S. is really a two-pronged one. First, the U.S. has what is widely considered a pretty mature and steady state family planning market, and much of that market is shifting alongside the rest of the retail industry towards e-commerce when it comes to points of sale. So looking at our first bullet point, projections for e-commerce growth are about 15% annually compared to 3 to 5% for the overall U.S. retail industry. Growth potential for health and personal care products like reproductive health supplies is particularly high in that because the industry has shifted more slowly to e-commerce for such consumable items, a dynamic that is changing of late. So basically, as the case outlines in far more detail, Americans are increasingly buying things, including family planning products, online instead of at brick-and-mortar locations. This in and of itself, though, doesn't tell us much about whether e-commerce could fundamentally change the American family planning market. The same consumers buying the same goods and services just through different points of sale doesn't on its own mean any expanded access to family planning goods and services. At least not until you consider these next 3 bullet points, all of which are further conclusions about market forces that our case draws from the range of enabling and hindering factors we explored when it comes to the potential for e-commerce to disrupt the mature U.S. family planning market. The second part of our story, if you will. First, we're seeing opportunities for new products and players to enter the American reproductive health market, meaning more options available to existing and would-be consumers thanks to e-commerce. Basically, e-commerce seems to be lowering barriers to entry, which means more companies able to enter the market and greater room for product differentiation. For example, the case highlights the recent rise of eco-friendly condoms. Next, e-commerce is bringing a shift in product distribution channels, meaning more ways for existing and would-be customers to physically access family planning goods and services. One example the case looks at here is the shakeup and expansion of the already established and expansive U.S. delivery industry that things like on-demand are causing. We look at mobile apps that allow for the purchase of contraceptives delivered on-demand, often anonymously, to your door. We also see major drugstores like Walgreens partnering with on-demand delivery services like Postmates to now deliver the suite of contraceptives they offer same day. Finally, we see new internet infrastructure and demographic trends around internet use that can expand customer access to family planning information, particularly among key demographics. A general finding across the case studies, as you saw, was that information provision is an entry point for consumers. With the internet comes a burgeoning library of family planning information sources online that inform consumers and position them just a click away from online points of sale. This is an area particularly ripe with opportunity when you look at something like American teens as a demographic being the most at risk of unintended pregnancy and most likely to be online. So moving to the next slide, this two-part story is telling us that not only are Americans now purchasing family planning goods and services online, but that the rapid rise of e-commerce could shift the overall American family planning market in a way that expands access. Increased competition and a more empowered buyer pool are generally two good indicators of a market that is opening up to more options to consumers and likely to reach more people. These are initial hypotheses, of course, and we suggest areas for further research to flesh them out in the case. But potentially, e-commerce is poised to be a disruptive, and that's in a positive way, force for what has been for some time a pretty mature and steady state American family planning market. And with that, I'll hand it back over to Nikki.
Thank you, Jen. I'd like to now introduce Nanjira Sambuli, who will present the findings on the Kenya case study on behalf of iHub, which is a tech hub in Nairobi. Nanjira is currently the research lead and provides strategic guidance for the growth of technology research in the East Africa region and supports her team in finding information useful for the emerging technology ecosystem in Africa.
My name is Nanjira from Nairobi, Kenya, and I'll be briefly presenting on the findings from the e-commerce study here in Kenya through a series of informal secondary research and literature reviews, as well as an informal survey of about 27 men and women based in Nairobi, as well as key informants with representatives of various e-commerce and reproductive health stakeholders. So we found that e-commerce users in Kenya are young, busy, techno-savvy, and with disposable income. And these are e-commerce users across the spectrum. We found that more specifically with people who are urban or dubbed as urbanites are more likely to use the internet and like internet-friendly short-term spacing methods of reproductive health. And so this is a market waiting to be tapped into. Some of the interesting challenges or opportunities, if you, however you will, are that infrastructure and trust in technologies, which includes logistics, payment platforms, and networks with existing providers, are still low but growing. Growth here could be driven by the fact that there's poor physical access to supplies in any case, and the fact that we have online payment platforms like the world-renowned M-Pesa that could drive the payment of such access to such supplies. Last but not least, Kenyans also want e-commerce to provide information and counseling on family planning. That means when they sign up or trying to purchase a product online, they want to be able to consult on the nature of the product, especially if they're doing it for restocking their supplies, and also when they want to use a new method. One of the most interesting quotes from one of the stakeholders we spoke to was that the prospect for e-commerce in Kenya is very high. Stores are too expensive because the supply is low, and the cost per square foot is still high compared to the cost of goods. Access to retail in certain areas was bad, hence the need for e-commerce. So there is a huge case for consumables being brought online, especially if they're all being sold in one area of the country. As a parting shot, I would perhaps add that one thing we learned from this as well is that as much as we're looking to the digital infrastructure, we still do the physical infrastructure to close the value chain. And so there are opportunities and interesting challenges in Kenya going forward. Thank you.
Now I'd like to introduce Minnie Thakur, who will present the results of the India case study on behalf of CARAC. Minnie is an international development expert with over 16 years of experience in research, M&E, and advocacy for international development agencies. Her work has spanned a wide range of issues from the ground level to international and regional levels. Minnie, go ahead.
Thank you, Nikki, and greetings from India. Our case study focused on e-commerce of non-clinical spacing methods in general, where we found that condoms are the most widely available options with a number of choices. Many of our findings are resonated in Kenyan's case study, where particularly in terms of consumer profile, issues relating to logistics and payment platforms. For today, we are highlighting the findings about how e-commerce companies are making efforts to deal with issues, A, about privacy, and B, about providing alternatives for payments. In order to highlight the issue of privacy, I'll just give you 3 examples of how serious the issue is here. We interviewed pharmacies in Delhi, and they said that they rarely receive new women customers for contraception. In villages, the health workers talk to adolescent or unmarried people about contraception services. And NGOs who provide services on ground say that more single women access abortion services than contraception services. So that highlights the seriousness of this issue and how e-commerce companies are responding to it. We found some interesting findings. First, we found that all companies proactively advertise their guarantee of privacy. Some even show the packaging images on their website to convince the consumers about how they would maintain privacy. Most websites list contraception under health and wellness segment or club it with other products like cosmetic or lingerie, etc. Products, when they are shipped, are in discrete packaging. You can see on the screen the image where the actual package, you see the name of the book, The Art of Scorings, but when you open the book, it's actually the 4 packets of condoms with these pictures in them. So the image on the panel is of the open book. This is from the order we placed in order as part of this study. Now, we also found that if the company's name is too revealing, for example, buymecondoms.com, they would ship it as BMC using their acronym, or they would use their parent company names on the packet. Credit card statements as well use non-revealing description of transactions such as medical supply, healthcare, item, etc. Let's come to the second limitation about mode of payment. Although India has increasing segment of people who use online transactions for payment or credit cards, but still it is not at par with the growth seen in online purchasing. To deal with this situation, e-commerce companies offer cash on delivery, which is called COD alternative. The system is not favorable for the e-commerce companies themselves because they face a lot of negative situations. Consumers reject the delivery, or sometimes it is just a prank. Sometimes the address that is given is not the person who has placed the order, etc. Nonetheless, 46% of all payments are done through COD modality. Let's go to the next slide and look at the code in order to also to understand the next slide. Next slide, please. One of the persons we interviewed said, I just like to see and feel the product before I buy. So this also sort of compels the companies to adhere to the COD payment. Many more interesting findings are available in the case studies, which IRH has already put online. This is just for now, and I would finally I would like to thank my colleagues, especially Dustin, for his hard work and continued interest in this subject throughout this study. Thank you.
Thank you, Minnie. So our Mexico partner, MexFam, couldn't be here today, unfortunately. So I'm going to present a small portion of their results on their behalf. They found that in Mexico, e-commerce is rapidly expanding. Access to the internet continues to grow, and a large portion of the population has access to a payment method, primarily credit or debit cards. Many people are already purchasing products online, both locally from manufacturers in Mexico and internationally, especially from the US. Many RH supplies, including oral contraceptions, EC, and male and female condoms, are available online from multiple types of sources, entirely without prescription. However, access to these is limited, not by the factors that you'd expect, but by poor search capabilities and lack of information. I thought this was very interesting. On many Mexican sites, you must know either the exact brand name for the product that you're looking for or the drug formulary for it, which of course makes it difficult for customers who only know that they want the general type of RH supply, not necessarily exactly the product that they want. The other key factor that our Mexican partner found was demographic. The population is young, and young people in Mexico tend to have a higher demand for the type of short-acting methods that are available online. They also exhibit much higher rates of online purchases, which could lead to a trend as those two factors combine. Next slide. As our MexFam partner told us, companies will need to respond to this demand by making their products easy to find, or else the online market for reproductive health supplies will remain in its current small state. I'd now like to present Heidi Van Hoof. She is an advocacy officer at Rutgers, where she focuses on country-level advocacy related to development programs and policies on sexual and reproductive health issues. This includes work on the Universal Access to Female Condoms program.
Of the case study is that e-commerce of female condoms is likely to gain importance as a means for distribution that runs parallel to and does not replace offline sales and programming around female condoms. Despite some uptake in selected locations, suppliers face challenges in increasing online sales. Some of these challenges are related to customer behavior and preferences, to which I will focus my presentation today. The first hindering factor that is underlying all hindering factors is the lack of gender equality. Women's sexuality and empowerment remains a challenging topic in many societies. Lack of gender equality continues to pose a barrier to access to reproductive health supplies worldwide, and to female condoms in particular. As explained by a local NGO representative, women are not supposed to be going online and logging onto websites where they can see about condoms and sex. In India, it's almost impossible for women to have such a product delivered to them, either at home or at work, due to the associated stigma. A customer-related hindering factor for the sale of female condoms via e-commerce is the lack of product awareness. Most people simply do not know about female condoms, and as a result do not search for or buy the product, either offline or online. All respondents identified this as the most important barrier to the sale of female condoms via e-commerce. One manufacturer explained, as long as you do not have any product awareness and then no brand awareness, it is very difficult to get people to go to your website and actually purchase the product. However, product awareness can also be seen as an enabling factor, because the lack of product awareness hampers offline sales, and respondents argued that this challenge can be addressed by e-commerce to a certain degree. The presence of female condoms online helps to increase overall awareness of the product. If female condoms appear next to male condoms during an online search for condoms on a large web shop, awareness of the product increases. As explained by one respondent, it helps make the product more known, it normalizes it. Another hindering factor to customer behavior and preferences is the lack of interpersonal communication. Many women and men are not familiar with female condoms or their correct use. Demonstration of how to insert and use female condoms correctly is essential for uptake and sustained use. Such instructions are time-consuming, but results from female condom programming around the world show that interpersonal communication is essential for good uptake. Several respondents therefore assert that it would be difficult to get first-time users to buy female condoms via e-commerce. One manufacturer said, whether it is through a friend or through a training or through a doctor, that does not matter, but person-to-person contact is crucial in making up someone's mind in buying the product, let alone buying it online. Online videos and learning materials can instruct people in places where there is sufficient bandwidth, but they may not fully replace the interaction and confidentiality of live instructions. The next slide, please. Can't believe I waited so long to try this. It's fantastic. Just wish they were sold in stores. Women should have equal ease of access to products intended for them anyway. This is the summary of the quote. So this is my presentation. Thank you.
Thank you very much, Heidi. I'm introducing Elizabeth Wesley, the director of the International Consortium for Emergency Contraception, which is hosted by Management Sciences for Health. Elizabeth has led the consortium since 2005, and she'll present to us the results of the EC study.
Great, thank you. I hope everyone can hear me. I just wanted to start by thanking the RHSC, IRH, and my two consultants, Jamie Bass and Tina Pooch, who really helped with this. And we also interviewed 4 vendors, 4 online vendors, 2 for-profit and 2 non-profit, and they were really incredible at sharing information about their challenges in providing this method online process. As you can see here, there are 3 different categories of access for emergency contraception, and I should just say emergency contraception, which can be taken after sex, has a time limit, and this was a big factor in how women are using the internet to access EC, and there's a lot of challenges and factors related to this urgent need for access, and so there was kind of 2 different approaches to sale, and one was the urgent need and the other was to have women purchase EC in advance of use. So in a full over-the-counter non-prescription setting, as Jennifer described in the US, or as we also see in Mexico, there's really routine e-commerce. Your chain drug stores will be selling EC pills, the non-prescription EC pill in the same way that they're selling, you know, tissues or cough medicine. Also marketplaces such as Amazon and Craigslist that really offer a platform for a range of sellers and some specialized sites as well. A lot of Europe has a behind-the-counter status for emergency contraception or prescription in some settings or with some specific brands. In the US, an EC product called Ella is available by prescription, and many European sites require a behind-the-counter screening. So there are different creative ways that online vendors are dealing with this regulation around prescription or screening, and QuickMed in the US has actually clinicians who can write prescriptions in all 50 states, so you can imagine that's quite a process to put in place. And then in Europe there's a lot of strategies around online checklists, and some of those sites do offer, for instance, a 2-hour delivery, Mr. Ed in London, so bicycle or cycle delivery. Then we found a number of countries where there's no legally registered product, and those are, EC is available in most of the world, but there are some notable exceptions, some Latin American countries, the Philippines, Malta, and online access really does seem to offer a way for women to learn about EC and potentially to access EC in these settings. In the Philippines, there are sites that offer medications, websites, but you have to telephone to be able to find out how to order them. There's a British site that serves Malta where EC isn't available. There's also a website called Women Help Women that's a nonprofit based in the Netherlands and Canada, whose mission is really to connect women in restrictive settings with reproductive health products. So there's really a range of access, but we would say in most parts of the world there was some kind of online access, except for in Africa where we were not able to find any online access to EC yet. But I think, as Victoria pointed out in her opening slides, this is really more about infrastructure and less about the emergency contraception product itself. Next slide, please. So this is a quote from one of our online vendors, and he is saying that access is not about availability, it's also affordability. And he sees that the e-commerce platform can hugely reduce barriers. It does take away those brick and mortar costs and allow vendors to connect directly to customers. Thank you so much.
Thank you, Elizabeth. Now I would like to introduce Leslie Heyer. She's still a social entrepreneur and the founder and president of Cycle Technologies, and she's presenting on the CYCLEBEADS and standard days method case.
Thank you, Nikki. So CYCLEBEADS have been available since 2002, and from the beginning they've been made available through a global e-commerce site where individuals could purchase them. They are also made available through a number of international dedicated sites, as well as sort of retail e-commerce sites that offer a range of product. And in many ways, CYCLEBEADS are a great product for e-commerce in that they don't require prescription. They can be used without professional counseling. They're low cost. They have a long shelf life. They're pretty easy to ship in that there are very few regulations from an import-export perspective. But there are some challenges. In addition to the challenges that were described by some of the other methods, such as lack of awareness, some of the misperceptions around this type of a method, CYCLEBEADS has a pretty unique issue in that it is a one-time low-cost purchase, which makes for a difficult revenue model. The cost to educate and acquire a customer can be far higher than the potential income, which makes it hard for dedicated sites and even retailers who have multiple products to cover costs. And it really limits the amount then that they can invest in generating awareness. That said, we still have found that e-commerce is much more efficient than going through traditional brick and mortar retailers. Something though that's really changing the landscape is mobile technology. As an information-based method, and particularly as a very easy-to-use method, it's possible for people to use this method entirely through a smartphone or mobile device. In areas where smartphones are being widely used, it looks like many people are starting to use the apps over the physical products. It's much more efficient for them to use it that way. They find it's actually proactive. So there are a lot of advantages that the apps or online services may have over a physical product. Additionally, the large app marketplaces are bringing together people who are looking for apps. So if you go to Google Play Store or iTunes, you find millions of people are actually looking for apps there. So it's a very cost-effective way to reach people and an easy way of reaching a large number of people. This can circumvent a lot of the procurement and logistics challenge that we've all seen with traditional procurement. There are still some challenges, though, that we're finding. The first is that mobile technology is not going to reach everyone, at least not in the immediate future. I mean, analysts are predicting that 6% of the world's population will use a smartphone by 2020, and much of this growth is coming from the emerging markets and developing markets. But it's going to take time before everyone has access. Additionally, though, a real problem has been that it's a challenging landscape. There's a lot of misinformation or partial information out there, and a lot of tools which make some similar claims, and it can be hard to distinguish between the hundreds of period trackers and ovulation predictors and pill reminders that are out there, especially when some of these are making some ambiguous claims. It's a much less regulated market. CYCLEBEADS and a new method and app which we've recently launched called DOT are the only period trackers that can be used for pregnancy prevention. But again, this gets lost sometimes from the user perspective when they see all of the other tools that are out there. So we're very excited about how technology is changing awareness and access to this method, and we're really trying to be thoughtful and diligent in ensuring users and the health community understand how the CYCLEBEADS digital products work, how they've been tested, and how they differ from all of these other fertility apps and trackers that are out on the market. One of the doctors we interviewed said that her patients are walking in with phones in their hands, and so having a contraceptive option that they can use entirely through that device, it really fits into their current lifestyles.
Thanks so much, Leslie. Now, as you've heard from all of our partners, they did excellent work distilling insights from a lot of data on a huge, complex topic down to a few key findings. But this is a dynamic field that's quickly evolving, and within a short time, the findings from this study could be dated. Given that we couldn't cover everything, and that change is the one constant, we've identified many questions that would benefit from additional research. Here are some of the things that we talked about, that we thought about. A lot is about the consumer behavior and what options will be available to them now and in the future, and how their preferences will influence it. But now we'd like to hear some of your questions for us. Many of you have already asked them, and we invite everyone else to type your question into a chat box at the bottom right of the screen. I'd like to start with our first question, which is directed at Elizabeth. How did quality assurance play into buying EC online? Did you have any findings around that topic, particularly how it affected consumer trust?
Thanks so much. We didn't really have any findings about poor quality products online, but it was voiced as an issue, and Leslie brought it up as well with CYCLEBEADS. and with this, you know, all these apps. And I think it's really an important issue that needs to be addressed, which is how do you assure quality online, honestly, in the less regulated countries. We can usually assume that if we're buying an EC product online in a fairly regulated environment, maybe from a chain drugstore, that it's probably the same products that you get in the store. But I think in other environments, the whole issue of regulation of quality in online sales is going to be one that, as the market grows, this question will also grow.
Thanks, Elizabeth. Jen would like to jump in as well from a U.S. perspective. Please, go ahead.
Hi, everyone. I'll add just very briefly that one of the interesting things that I came across in my research, and that didn't quite make it into our study because it was sort of something we were only partially understanding in the research, but it sounds like through Amazon and through secondary vendors, certain customers have surfaced through customer reviews and things like that, lack of quality assurance as well. So when the actual vendor selling and sending out the contraceptive products, the family planning products purchased, becomes someone one step removed from the online platform, that's also an opportunity for some trouble to arise. At least we're seeing that in the U.S. context.
Great, thank you, Jen. To our panelists, if any of you have anything that you'd like to add to any of these questions, just type me a brief note in the chat box and we'll unmute you. So I had a question listening to some of these presentations, particularly from India and Kenya, around what the gender dynamics were on online purchases. Minnie, you mentioned that there was particular problems for unmarried people. Did you find any other barriers for women purchasing products online? And we'll direct that to Minnie at first.
Women purchasing online access, like the feedback that we get, that it certainly increases women's access, particularly those who are connected to internet, educated, urban. So that way it is easier for them than going to a conventional brick and mortar store. But for a large majority face the similar barriers as men, and they are in situations where the societal norms play a much bigger role in their lives.
Nanjira, did you have anything to add here? I know that was an issue in Kenya as well. Nanjira, I think you're still muted.
Sorry about that, just double safety. Yeah, based on, for instance, some of the online pharmacies we found in Kenya, we found that only one sold any family planning products, not including condoms. So there were 3 sites we found that we could purchase condoms, and in this case, I believe they were male condoms. And as far as general dynamics of e-commerce go in Kenya, once you move outside of Nairobi, where you may find pretty much on a gender divide, anyone who has access to a mobile phone is very likely to be accessing the internet at a pretty affordable rate. You find that the gender parity is quite huge even from other studies, and this is a challenge that will take a while to overcome. Even cultural barriers, you find mobile phones sometimes may be the property owned by the man in the family, and so if that's going to be the primary point of access to e-commerce sites, for instance, it does present a challenge as to how those women would have access to that. So there are all these roundabout figures and anecdotes coming in around the gender dynamic of access, as it were.
Heidi is actually the one that sparked that question, since her female condom gender is such an important issue there. Heidi, do you want to have any other thoughts to add on that topic? Oh, Heidi has not online. So I'm going to move on to the next question, which is directed at Jen. And the question was, how does the Affordable Care Act and that implementation affect the purchasing of contraceptive online in the U.S.?
I believe I caught the question. I had a brief break in my audio, but so in terms of the Affordable Care Act, at a very high level, what our research and interviews with some sort of U.S. healthcare experts said to us was that whether it's e-commerce or traditional brick and mortar purchases, that the Affordable Care Act, when it's applicable to a method of family planning, can actually function as a price subsidy. Right, so insurance coverage, particularly expanded insurance coverage, lowers the price of certain methods for American women who have that coverage. Now, in and of itself, again, that doesn't tell us a lot about e-commerce expanding access, except the one thing we thought was kind of interesting here is that when you look at a market that has such an expansive government-infused price subsidy, and that actually stands along things like Title 10 and price subsidies that come along with that, then you have a market that might be uniquely attractive to would-be entrants. So particular companies that may or may not have had an interest in the reproductive health space may suddenly see a sort of artificial price incentive to try playing in this market. And e-commerce with kind of its lowered barriers to allow new entrants into the marketplace, all that considered together may, again, we think, be reasonable grounds to assume that there could be some expanded access to reproductive health supplies for consumers thanks to e-commerce overall.
Okay, our next question is to Leslie, and the question is, how has the growth of these digital tools impacted the sales and distribution of the physical tools? Has there been any interaction as these two products have grown and changed?
Yeah, actually, we've seen as people have begun transitioning more to using apps, so in markets where smartphones, for instance, are widely used, that there's actually been a real decline in the physical product. I mean, you still have people who are interested in using a physical product, but absolutely trends towards wanting to use the apps. I think we've heard from users that it's a more convenient way for them to access it. They can get it for free. It's right there on their phones. There's just a lot of advantages to being able to use it that way. There are still a few diehard people who are going to always want to use a physical product, but the trend is absolutely towards using the apps when they're available.
Thank you, Leslie. Our next question is for Nanjira, and the question is, how is e-commerce being used in rural areas, and what are the distribution challenges there?
I believe the question is rather posed to me. Right.
Yes.
So this is based on other research on e-commerce and trends in Kenya. I mean, unfortunately, it's still very much an urban trend, so we find a lot more e-commerce taking place in the cities where people are more connected. And in fact, one big incentive for using e-commerce in the cities is just the ease of accessing stuff like food deliveries and groceries, because it's just a bit more hectic sometimes to access them because of traffic. But with once you start moving out of the cities and the towns, the bigger towns in the country, you then find that the landscape is yet to adopt. We have mobile money, which is a big player as far as digital inclusion goes, but we are yet to see that uptake in other areas on e-commerce. However, I think this is a trend that's about to change, and it's calling actually for a lot of studies, because even from the government level, we're seeing digitization of services, which means that there's infrastructure, accompanying infrastructure to make the cost of access outside of urban areas much, and therefore I think the demands and trends of consumption will adopt with time. But currently we have, as far as any form of digital payment systems going, M-Pesa is still king and will remain that for a while to come.
Thank you, Nanjira. This next question is for Minnie. Do you think that the e-commerce will be looked at as an opportunity for government, to either state government or national government, to explore in any of their family planning or reproductive programs?
Well, we did interview the health department and people who work closely with the head of health department, and we didn't find any trace of any ambition to use this platform at the moment. Some also are skeptical of the logistical challenges, very similar to what Nanjira has said, that even if they make it available online, the last mile connectivity is so poor that it will have the same fate, and there has to be a physical infrastructure where people could go and buy things. So that's where government is, although there's a huge drive on digitalizing India, but not so far very clear about this segment.
Thanks, Minnie. Now this last question is for all of the panelists, and it is, what are the concerns for lower income populations who may not have the same access to online as other people? And this is a general question. What did you see when you were researching your case study around these lower income populations? Let's start with Jen.
It's a very interesting question, Nikki. I think when we looked directly at low-income populations and internet use, when we were sort of exploring demographic trends around that, it wasn't as positive as with certain other groups who were particularly at high risk for unintended pregnancy. Low income does not correlate with higher internet use in the U.S. So that was discouraging. But what I will say, and it's a bit of a spin on your question, is that any way you slice and dice the sort of American population in terms of demographics that are at high risk of unintended pregnancy, well, then you start to maybe tease out some interesting correlations around internet use or greater reach thanks to sort of these new distribution channels that e-commerce is bringing into play for family planning products and services. So for example, one big barrier in the U.S. to access to contraceptives is actually physical location and how remote of an area you're in. And again, we played quite a bit with this kind of expanding U.S. delivery system and saying, oh goodness, like maybe we're seeing a situation where suddenly delivery to one's door, especially anonymous delivery, could suddenly bring physical access to goods for certain consumers otherwise missed. Or we also saw the emergence of online consultations and things like that, which again put the internet as a distribution channel reaching more consumers. So not a perfect answer, unfortunately, but hopefully through further research we can start to delve into that low-income demographic a little more strategically.
I'm going to send that question to Leslie for an additional response now.
Thank you. Yes. So, analysts are predicting that over the next few years, more and more people are going to have smartphones and or internet access. I think, as I mentioned in my earlier slide, 70% of the world is expected to have smartphone access by 2020, and even more will have internet access. In our case, though, I would guess that we are much more likely to reach them with digital tools like apps before we'll reach them with e-commerce because of some of the infrastructure challenges we've talked about. So I think people are going to have internet access way before we fix all of the other issues that may go along with being able to order things through an e-commerce setting.
Thank you, Leslie, and thank everyone on our panelists and everyone who sent a question for their very interesting discussion. If I was to sum up some of the points that would have been made, well, we heard from Jen that e-commerce alone and that landscape doesn't automatically provide a disruption to the RH supplies market. We heard from Ninjira that e-commerce and family planning in Kenya is low but seems to be poised for growth. We heard from Minnie about the concerns of Indian consumers, particularly around privacy and payment, and from Mexico on the importance of good search capabilities. Our female condoms partner told us about the importance of awareness, gender equality, and clear communication on how to use products, particularly for new and underused products. And Elizabeth talked about the prescription requirements needed for emergency contraception and how those could impact the landscape. And finally, we heard from Leslie on how e-commerce can change the way an entire product is distributed. It's clear from all of this that e-commerce will not replace offline sales and distribution, but it could be a critical path to bringing RH supplies to women and men around the world. I'll leave you with this last slide depicting what may be the future of e-commerce. The short time we had together was not sufficient to share everything that we learned during this research project. In addition to the overview report, which you've heard some about today, each of the partners, in collaboration with IRH, has written an in-depth case study, which is available at the link shown. You can also join the conversation on social media. We're at IRH_GU on Twitter and Facebook. I'd like to thank our funders from RHSC and USAID for making this project possible. It's been a fascinating look at a very interesting topic for us, and we've enjoyed the opportunity to work on it. Thank you all for joining us today. This webinar will be available online if anybody you know has missed it and would like to come back and listen to it.